friends, welcome to the channel Dewdear Academy. So today in this video I have included the MCQ discussion as part of the preparation for various competitive nursing examinations. And the upcoming exams are nursing tutor, then ESIC exam and also the DSSSB. So for all these exams, for all the competitive nursing exams, this video is useful and I have selected some of the questions from psychiatric nursing. So first let me start the first question. A patient experiences that he is hearing voices of people who are talking several kilometers away. What type of hallucination it is? A patient experiences that he is hearing the voices of people who are talking some kilometers away. So in this question, the patient is hearing voices some kilometers away. He is hearing the voices some kilometers away. So what type of hallucination it is? Options: visual hallucination, auditory hallucination, extra campaign hallucination and reflex hallucination. So in this question we should know the different types of hallucination. First it is given in the option visual hallucination. So what is hallucination? What is hallucination? Okay, what is hallucination? Hallucination is a disorder of perception. Hallucination is a disorder of perception. That's the first point that you should understand. It is a disorder of perception. Disorder of perception. That means the false sensory perception without the real stimulus. There is no real stimulus. Without the real stimulus, there is a false sensory perception without real stimulus. So what is, if there is a real stimulus is present and if there is a misinterpretation of the stimulus, that is known as illusion. So that is another point. What is illusion? Illusion is in the presence of an external stimulus, there is a misinterpretation of that stimulus. That is in the presence of real stimulus. In the presence of real stimulus, there is a misinterpretation of that stimulus. Okay, that is illusion. So here we are discussing about the hallucination. Hallucination is a disorder of perception and it is occurring without the presence of real stimulus. And first the type of hallucination is visual hallucination. Visual hallucination means here the person is sees a person or object that is not present. Okay, there is no real stimulus, means there is no real person, but the patient is he is perceiving, or he is perceiving the presence of a person or a stimulus. That is visual, that is related to the sight. Okay, visual, it means it is related to the sight and it is mainly found, this visual hallucination is mainly found in acute brain syndrome like delirium. It is mainly seen in delirium. Visual hallucination is mainly found in delirium. Then next is so here is just an example. Seeing a person who is not present is an example of this visual hallucination. Okay, seeing a person who is not present, mainly found in delirium. Then auditory hallucination. Next is the auditory hallucination. What is auditory hallucination? Here, perceiving the sound without any auditory stimulus. Perceiving the sound without any auditory stimulus. Without the exact sound is not present, but the patient is perceiving some kind of sound, that is known as auditory hallucination. And it is the commonest type of hallucination. It is the common type. Commonest type is auditory hallucination. Okay, that's a common type. And this is mainly found during alcohol withdrawal. In case of alcohol withdrawal, auditory hallucination is found. Alcohol withdrawal cases. Then schizophrenia, mania. Okay, in case of schizophrenia, then mania, amphetamine toxicity. In all these cases, auditory hallucination is found. Then next we are discussing the options list. It is found extra campaign hallucination. What is extra campaign hallucination? So here I will write extra campaign hallucination. Extra campaign means patient describe the experience of visual hallucination or any sensory stimulus that is located outside the field of vision. Outside the field of vision. That means extra campaign hallucination means the hallucination that is experienced outside the limit of one's sensory field. The hallucination that is experienced outside the limit of the sensory field. Outside the limit of one's sensory field. That is extra campaign hallucination. Example: if the patient is experiencing a visual hallucination that is located outside the field of vision. Okay, that is known as the extra campaign hallucination, which is found or which is experienced by the person that is outside the limit of the sensory field. And this extra campaign, this term is coined by or developed by Eugene Bleuler. Eugene Bleuler coined or developed this term. Okay, extra campaign means the term is derived or coined by Eugene Bleuler. So that is also important. Extra campaign hallucination is experienced outside the limit of one's sensory field. Then reflex hallucination. Reflex hallucination. Reflex hallucination means here there is a sensory stimulus in one modality is resulting in the sensory experience in another modality. That is known as the reflex hallucination. Reflex, here I will write the reflex hallucination. Reflex hallucination means a sensory stimulus in one modality. In one modality, a sensory stimulus in one modality result in a sensory experience in another modality. Sensory stimulus in one modality will be resulting in a sensory experience in another modality. Just I will give an example. Okay, reflex hallucination means if the person is perceiving a loud noise, during that time he is perceiving a colorful visual hallucination. He is perceiving a colorful visual hallucination. In case of a loud noise, he is getting a colorful visual hallucination. So there is a loud noise means that is one sensory stimulus. So if there is one sensory stimulus, at that time he is experiencing another sensory experience. Okay, in case of there is a sensory stimulus in one modality and that is resulting in a experience in another sensory experience in another modality, that is reflex hallucination. So these are the different types of hallucination which is given in this question. He is hearing the voice of people who are talking several kilometers away. A patient experiences that he is hearing the voice of people who are talking several kilometers away. What type of hallucination is it? From this you can identify, isn't it? This extra campaign hallucination. It is extra campaign. So the answer is option C is the answer. Extra campaign hallucination. Extra campaign hallucination I have already told. Here he is hearing the voices that who are talking several kilometers away. Several kilometers away. That is outside the limit of that one's sensory field. That indicates it is outside the limit of the sensory field. That is extra campaign hallucination. Outside the limit of sensory field. Extra campaign hallucination. Then the next question. Lack of insight is not a feature of. Lack of insight is not a feature of. Options: panic disorder, schizophrenia, mania and reactive psychosis. Panic disorder, schizophrenia, mania, reactive psychosis. So in this question, we should know different types of disorders like neurosis and psychosis. So we should be clear with the different types of disorders like neurosis and psychosis, and also what is insight. Okay, first is psychosis, and neurosis. We should know the difference in these two. For psychosis, insight is absent. For psychosis, insight is absent. And for neurosis, insight is present. For neurosis, insight is present. What is insight? That means the person does not realize his disorder. In case of psychosis, the person does not realize his disorder. That is means insight. Does not realize his disorder. But in neurosis, he will realize or he can realize the disorder. For neurosis, a patient can realize the disorder. Then we can find some other changes. That is the thought, speech and communication is getting changed. Thought, speech and communication is changed in case of psychosis. But for neurosis, it does not affect the thought, speech and communication. It does not affect the thought, speech and communication. And also organic reasons may be present in case of psychosis. Organic brain problems will be present. So organic reasons are present, but for neurosis, organic reasons are not present. And genetic factors are also important in psychosis. Genetic factors are important, but for neurosis, genetic factors are less important. Then stressful life events are less important in psychosis. Stressful life events are less important in psychosis. It is less important, but it is present in neurosis. Stressful life importance are more important in neurosis. And which one is easy to treat? The psychosis is bit difficult. It is difficult to treat, but neurosis is easy to treat. It is difficult to treat, but neurosis is easy to treat. So that is some of the difference in neurosis and psychosis. And which are the disease conditions that is coming in psychosis? Psychosis, it include the functional disorders. Functional disorders like the schizophrenia. Then affective problems, affective disorders. Which are the affective disorders that include? Yes, that include mania and depression. Mania and depression. Affective include mania and depression. Then organic brain problems. Organic brain problems include acute and chronic brain problems. Organic brain disorder. Organic brain disorders include delirium, dementia and all. So these are all coming under the psychosis. Then in neurosis, mainly the anxiety disorders. Neurosis include, the first one is anxiety disorders and panic attacks. Okay, the severe anxiety include the panic attack. So that is coming in neurosis. Again depressive, depressive neurosis is coming here. Depressive neurosis. Then hysteric problems, hysteria. Hysterical neurosis is coming here. So hysteria. Then phobia, OCD, all these are included in neurosis. Phobia or fear, then and also OCD. So these are the difference in psychosis and neurosis. The differences in psychosis and neurosis. For psychosis, insight is absent, and for neurosis, the insight is present. So with this knowledge, then again read the question. Lack of insight is not a feature of. So first option given here is panic disorder. Panic disorder is coming in neurosis. Panic disorder is coming in under neurosis. So we know neurosis means insight is present. Okay, neurosis means the insight is present. So lack of insight is not a feature of panic disorder. In schizophrenia, lack of insight is a feature. So this is not the answer. And also in mania, depression, that is coming in affective disorders. So here lack of insight will be present. And in reactive psychosis, it means acute psychosis with excellent prognosis, mainly that is emerging in response to stressful life situations. In case of stressful life situations, the type of psychosis developing is known as the reactive psychosis. So here also insight will be lack of insight is a feature. In panic disorder, lack of insight is not a feature. So here the answer is option A. Panic disorder is the answer. Option A is the answer. So thank you for watching this video.